this has to be multi-sectoral, because there are so many sectors that will require our attention when it comes to inclusiveness, particularly health and education, but also housing and transport. These are areas that probably the latter two, we haven't done much, housing and transport, which we need to look into. But so far I can say we've done quite well when it comes to health and education. And the reason is because we have the right policies in place. We are taking care of it from the taxes of those who can pay. But now, as you've heard from the ministry, we are coming up with the type of health insurance, which will eventually go into having a universal health insurance for everybody. And we will definitely put a particular emphasis on those with disability to be able to have this card for them to be able to get services that are required. I would like to see that we are working together. When it comes to health, you have already started supporting us. Education, we have some partners already, but we'll need more partners when it comes to the requirements, particular requirements for the disabled. But the area of shelter, housing, so to speak, is something that I think if we start working on it, if we start deliberating on how best we can support them. And the good thing is we have the organizations are here of people with disability. They are quite organized, so it is not very difficult to support them when it comes to new initiatives. So I would very much like to see, because now we are talking about assisting government employees to get housing, then we should have something for the disabled as well.
And we have supported the Minister of Health through Mnazi Hospital, and the Executive Director is here, Dr. Muhidini. We provided almost 1 billion Tanzanian shillings for a project which focuses on eye health in terms of service provision from the community level up to the level where they'll be able to have access to eye health services. There's also a component for renovation and of the hospital at Mnazi, especially the eye care department, to ensure it is accessible to persons with disabilities. But we are talking about inclusion. All people can have access, because we are saying we are all potential candidates of disabilities. We don't know what will happen tomorrow, so we have to prepare the environment and everything that can also service the entire community.